Hi class, this is Eva Williams, and today I'm doing an informative speech on the checks and balances of the OR. Recently on television there was a commercial, and this commercial was depicting hospital staff making mistakes and causing problems for our patients, and making these patients fearful of wanting to trust hospitals and doctors. I'm here today to say that is not true, that there are many checks and balances that we do in the hospital in order to make sure that every patient is safe. I've worked for 5 years in the OR as a unit clerk, and there are many checks and balances that we put into place in order for a patient to come in and have surgery. The first thing I want to say, first check and balance that is going to go through the whole procedure here, is our 4 main questions. The first question that's always asked our patient is, what is your name? The second question is, what is your birth date? The third question is, what procedure is being done for you today? And the last question is, what doctor is doing that procedure? There are many steps that you're going to be going through from the beginning that you were booked for the OR to the day of surgery. And our first step that you go through is called pre-testing. And in pre-testing, our nurse takes all your information, your name, your address, your telephone number, your insurance information, and she gets this pre-testing script from your doctor that tells her that you need certain tests before this operation. Now, most of these tests are to ensure that you are healthy enough to have this operation. So you'll have things like blood tests to show your sugar, you'll have an EKG to show your heart, the strength of your heart, you'll have a chest x-ray to make sure that you can breathe properly. So these are all checks and balances that are done before you go into surgery, way before you do surgery. Okay, so she does all of this stuff and then passes all that information on to the same-day surgery department. And in that same-day surgery department, they get things rolling by getting all the paperwork together and your chart together. As an OR unit clerk, as I am, it is my job to get the ball rolling. I need to take all this information, put it in a chart form, and make sure that the name and everything is correct there. All the labs and the x-rays are for that patient. And in addition, it's also my job to make sure that the OR techs get what is called a billing sheet, which gives them the name of the operation, the name of the person, and they will know what instruments to take out for that operation. Okay. So here you come in the day of the surgery, and you're going to go to same-day surgery. And again, yes, the nurse comes in, and the 4 questions that she needs to ask you are what? What is your name? What is your birth date? What procedure are you coming in for today? And what doctor is doing your procedure today? Once she's gotten through that, she will start to get you ready as far as dressing and making sure that you're comfortable in the bed. She'll start your IV in your arm so that when the anesthesia doctor comes in, he can start giving you medication. So once she's made sure that you are you and that you understand your operation or the procedure you're having done that day and who is doing it, then the anesthesia doctor comes in. He reviews your labs and your x-ray and your EKG that you did a couple of days before, make sure that everything is okay, and if he needs to order any other test from whatever he finds, he'll do that at that point. Once that is done, again, he is going to ask you for your name, your birth date, your procedure, and your doctor doing it, and then he will start the IV medication. Once the medication is in you, you start to feel a little bit woozy, but you're still able to talk. At this point, our OR nurse, she will come in, and she comes to ask you again your 4 questions. What is your name? What is your birth date? What is the procedure you're having done today, and who is doing it? And she says her name and tells you that she's going to take you to the OR to have your operation. She rolls you to the back, and inside the OR room, you now have your techs, your OR nurse, your doctor, your anesthesia doctor, and you have another anesthesia person that helps the anesthesia doctor. I can't pronounce that name. Anesthetist nurse. Okay? And all these people will be asking the same questions of each other. They will ask who this is, what she's here for, and who is the doctor. Once all those preliminary things are done, they put you to sleep. They do their operation, and during the operation, there are many checks and balances that we don't even know about. We have lists of all the instruments that we are using, and as they are used and they're placed on the table, they have to be placed back on the unsterile table and checked off. At the end of an operation, those things have to be checked off one more time to make sure that nothing was left in the patient or on the table or on the floor. All these instruments are checked to make sure that they are present in the bin. Once that is complete, then they will close the patient up and they will send the patient to recovery room. Now, when you get to recovery room, you think, oh, well, I'm groggy. They're not going to ask me these questions. Guess what? They still ask you the questions. Miss Eva, is that your name? Eva, is that your name? Is your birth date 10/18/1956? And you say yes. Well, these are all the checks and balances that they do in order to make sure you are you and you are getting what you need to have for that operation or for that treatment. What I'd like to say is that this commercial that's on TV, we are all human. And yes, there is a possibility that there could be a mistake done. But because there are so many checks and balances in our program I have to speak for the OR room. In our OR room, our procedures have so many checks and balances that if something does go wrong, we catch it before anything can happen to that patient. So I just want to be able to tell our people, my audience, that when you're in the hospital and you're going for a procedure or you're going in there for testing or whatever the situation is, I'm sorry. Let's start that again. I just want you to know that there is a check and balance system in place in the hospital that will help the personnel keep on track and try not to make mistakes. And if there is a mistake that is made, because the next check and balance is on his way, that check will prevent anything happening to you. Well, I guess that's it. That's my speech for today. Okay, thank you. Bye.